Is your brain doing well, or is there a little problem? Today, I will talk about the 6 signs of dementia that you should never ignore. We know that dementia affects over 55 million people worldwide and is the leading cause of disability and dependency among the elderly, as well as the 7th leading cause of death. Globally, you might think, oh, I'm young. Changes in brain neurons start decades before the first symptom appears. Therefore, stay alert. I will divide this video into 3 parts. The first part is about the 6 early signs of dementia that few people know about or realize that something is wrong. In the second part, I will talk about the 10 classic symptoms of dementia. Could the forgetfulness you're experiencing be one of them? And in the end, I will give tips on how you can prevent dementia in the future, or at least slow the disease. I will also talk about the latest developments that have emerged in recent months and why many scientists are hopeful that there is light at the end of the tunnel and that perhaps we are close to ending this terrible disease. If you or a family member is suffering from memory loss, it's worth. Watch until the end, but first like the video, because the more people like the video, the more YouTube distributes it to the right people and those who don't have access to doctors or hospitals. And also share the video with your friends and family. And tell me, have you been forgetting things recently, or do you have a family member or friend with dementia? Where in the world are you from? Tell me in the comments. First of all, what is dementia? Dementia is a general term that refers to symptoms that affect a person's cognitive ability, that is their mental capacity to learn something new, remember things from the past or what they just did, pay attention, make decisions, solve problems, and perform daily tasks. It is in the brain where a person's identity is stored, who you were yesterday and who you are today, what your personality is like, who you love or hate, what you like to do, your skills and what you have learned, and it is precisely the brain that dementia attacks. Deconstructing the person, making them lose their own self, losing their own reality. They don't just lose their keys. Dementia is a neurodegenerative disease where neurons die at a faster rate than normal aging, therefore dementia is not part of normal aging. You can live past 100 years old lucid without losing your memory or track of things. What are the types of dementia? There are several types of dementia, but the main one is Alzheimer's disease. About 60 to 70% of dementias followed by vascular dementia caused by blood flow problems to the brain. Around 20% there is dementia with Lewy bodies, about 10% of cases. That affected actor Robin Williams, and 5% of cases are due to frontotemporal dementia, also known as Pick's disease, which currently affects actor Bruce Willis. What are the 6 early signs you should watch out for that may indicate that you or a loved one is suffering from dementia? The early postural changes of dementia can be difficult to detect. Main, because others may assume it is part of aging or related to muscle weakness. These changes can include altered gait. The person may walk with shorter or slower steps. They might also start dragging their feet. There can be coordination problems, such as holding a cup or using a fork and knife to cut meat. The person may also start to become more hunched or lean to one side. As I mentioned, these postural changes are subtle and really difficult to see, especially if you are not looking for them. 5th sign, changes in sensory organs. Patients with dementia may start to have sensory problems, and the family does not notice. People may have problems with depth perception and spatial awareness. They may also notice changes in taste and smell. Starting to not sense smells, noise sensitivity, they become extremely sensitive to noises and find it difficult to deal with them. This can be especially difficult in places with a lot of people or activities happening like supermarkets or shopping malls, but also the person may start to lose hearing and need to treat it. There is a study published in The Lancet that showed that hearing loss in middle age is associated with a higher risk of dementia and may be the most important modifiable risk factor for preventing dementia in the future. Poor hearing makes the brain work harder to decipher the confusing signals the ears send. So if you or someone you know has hearing loss, treat it soon. 4 sign. Muscle strength problems. Dementia due to Alzheimer's is much more common in women. 2/3 of Alzheimer's cases are in women. It used to be thought that this was because women lived longer, but today men are catching up with women in life expectancy and the differences remain. Muscle strength is related to Alzheimer's. An Australian study that just came out with over 1,000 women with an average age of 75 found that those with a weaker grip test were twice as likely to develop dementia in the future. A frail elderly person has a higher risk of dementia. 3rd sign, sleep problems. This can be either sleeping too much, excessive daytime sleepiness. The person didn't nap before and now wants to nap in the afternoon. Insomnia, fragmented sleep, nightmares, vivid or intense dreams, restless sleep syndrome, where the person moves too much in bed, involuntarily possibly kicking, punching, screaming and groaning. This can be a sign of dementia, and poor sleep is a cause, as I will discuss later. 2nd sign, apathy, or in technical terms, anhedonia. This can be one of the early symptoms. Pay attention, the person used to enjoy many activities, loved to dance shop, and now has no motivation or interest. They no longer want to attend family events, no longer want company they once found pleasant. They have abandoned their hobbies. Of course, various psychiatric conditions can cause apathy, depression, anxiety, but in dementia it is an early symptom, because with the death of neurons, there is a change in the neurotransmitters that regulate emotions. First early sign of dementia, difficulty finding words. You are talking to the person and make notice that they have difficulty finding the right words. I see this frequently in my office. Sometimes a person may use a related word that is not exactly the right one, like using blouse instead of jacket. This difficulty is called aphasia. It was one of the first signs Bruce Willis showed. He couldn't remember the words. This can also affect names even of people they know well. The earlier you detect dementia, the easier it will be to treat, and you can slow it down and improve that person's quality of life. Now that you know the early signs and symptoms, let's move on to the more specific and advanced symptoms. 10 symptoms of dementia. 10th symptom, short-term memory problems. They remember how it was during the Second World War but don't remember what they had for breakfast. They may also have problems thinking abstractly and understanding numbers or symbols. 9th symptom, difficulty following conversations. The person who was previously forgetting words now can't follow the conversation because they forget recent information. The person may start interrupting others because they lost the thread of the conversation or have difficulty answering questions. 8th symptom, mood or behavior changes. The person who is loving now gets irritated easily. They were always cheerful. Now you find them always depressed. Additionally, they may become more agitated or have impulsive behavior. They may have more marked personality changes and may become suspicious or fearful. 7th symptom, difficulty making decisions. The person may have trouble making simple decisions or may have poor judgment, which can lead to risky or dangerous behaviors like leaving home without notice, getting lost in unfamiliar places, or leaving a stove on. 6th symptom, loss of sense of time. A person with dementia may have difficulty remembering the time or day of the week. They may forget what year it is and also forget important appointments or events, or become confused about daily routines like bedtime or mealtime. 5th symptom, repeating the same questions. The person may ask the same thing multiple times, even after receiving a clear and precise answer. This happens because dementia affects the person's ability to remember recent facts and follow conversations and daily activities. This can lead to repeating questions as a way to try to remember or understand the information. 4th symptom, disorientation. The person may get lost in familiar places. For example, going to the corner bakery or having difficulty navigating their own home or not recognizing their own home. 3rd symptom, putting objects in inappropriate places. You or the person you know is placing things where they shouldn't be. Anyone can temporarily lose their wallet or keys. However, a person with dementia may place things in inappropriate places, like a phone in the refrigerator or a watch in the sugar bowl. Second symptom, hallucinations. When dementia progresses, it can lead to hallucinations. Hallucinations can include the sensation of seeing, hearing, smelling, feeling, or tasting things that are not real. They might see people who have died, hear voices or sounds with no real source, feel a physical presence that does not exist, or sense a taste or smell that is not present. First symptom, urinary or feel incontinence. The person may have problems controlling their bladder or bowels as dementia progresses. The person may have difficulty recognizing when they need to urinate or defecate, or may have trouble remembering to use the bathroom. This can lead to episodes of urinary or feel incontinence, or the person may have difficulty reaching the bathroom in time. Of course, when dementia progresses significantly, the person does not know who they are completely loses track of time, may become more aggressive, does not recognize loved ones, and may have difficulty walking. What are the causes of dementia? There is a genetic component, but it is not the main one. What we do, what we eat, and the environment we are in greatly influence whether you will develop dementia. For example, head trauma increases the risk of dementia. A stroke is also a cause of dementia. A recent study found that over 60% of people who had a stroke experienced significant cognitive decline within a year. Chronic infections like HIV increase the risk. Circulatory problems like generalized atherosclerosis, cord plaques increase the risk. Atrial fibrillation without anticoagulant, also excessive alcohol and drug use, processed food nutritional deficiencies like lack of B1 and B12. So the causes are multiple. Now, how to prevent dementia? Is it possible? Yes, a study published in Finland found that interventions related to nutrition, physical activity, and cognitive training helped maintain brain function and prevent deterioration in a group of more than 1,200 elderly at risk. First, ensure your cognitive reserve. What is cognitive reserve? It is networks we build throughout our lives through education or developing complex skills such as riding a bike, speaking a foreign language, or playing a musical instrument. Think of a bank account. The more reserve, like a savings account, you build up over your life, the lower the risk of running out of money. This reserve allows your brain to continue functioning more or less normally, even when there is a significant loss of neurons or an accumulation of amylo or TOA proteins. There is a study of American nuns that shows exactly this. They catalogued several nuns aged 75 to 107 who agreed to donate their brains for post-mortem research. They analysed these nuns' diaries and conducted cognitive tests. Most of the nuns who had dementia had brains consistent with Alzheimer's, but the surprise was that several nuns with Alzheimer's brains died without any symptoms or signs of the disease. Who were they? They were the ones who had reported more cognitive and challenging activities in their youth. Diaries suggesting that the cognitive reserve built up over life can help protect against Alzheimer's disease. Second, do physical activity. Physical activity is crucial for your circulation, heart and brain. Remember, what is good for the heart is good for the brain, and vice versa. Physical exercise reduces stress, improves mood, increases BDNF, which makes neurons grow. That's right, it increases neurons and synapses instead of reducing them. Over time, it can be low impact. Aerobic exercises like walking, cycling, swimming, but weight training is also very important. As I mentioned, muscle strength reduces the risk of dementia. Lift weights to improve your mitochondria. Physical exercise is undoubtedly one of the greatest weapons for preventing dementia. Third, if you smoke, quit smoking. Smoking damages your lungs, blood vessels, and brain. It also increases your risk of heart attack and stroke. Fourth, control your blood pressure and cholesterol. Well, poorly controlled hypertension increases your risk of dementia, as does atherosclerosis. You need to keep both your blood pressure and cholesterol in check. Oh, and if you take statins, know that it reduces your risk of dementia by 15%. Fifth, if you are overweight or obese, it is important to lose weight. Visceral fat inflames your body, which in itself increases the risk of dementia, but it also increases the risk of sleep apnea and snoring, which worsens sleep quality. 6. If you have prediabetes or diabetes, it is important to try to reverse it. Alzheimer's is also referred to as type 3 diabetes because they discovered that there is abnormal glucose metabolism in the brains of patients with this dementia. Having type 2 diabetes triples the risk of developing Alzheimer's disease. Insulin resistance seems to play a key role in memory loss. Insulin receptors are highly concentrated in the hippocampus, the memory center of the brain. There are studies where insulin was sprayed directly into the noses of individuals with Alzheimer's, and cognitive performance and memory improved clearly. It is helpful to get glucose to neurons' insulin resistance. This seventh, improve your sleep. Poor sleep is a symptom of Alzheimer's, but also makes the disease progress faster. Researchers at the University of Rochester discovered that while we are in deep sleep, the brain activates a system that cleans brain waste. This cleaning process eliminates debris, including both beta-amylo and the two proteins related to neurodegeneration. If we don't get deep sleep, the system can't function effectively, and beta-amyloid and TOA accumulate between neurons. Studies have found that people who typically sleep less than 7 hours a night over decades tend to have much more beta-amylo and TOA accumulated in their brains than people who sleep 7 to 9 hours. Eighth, improve your diet. The Mediterranean diet and its variation, the MIND diet, which has more monounsaturated fats from avocado and olive oil and fewer refined carbohydrates along with regular consumption of fatty fish, has proven benefits. The ketogenic diet can also offer a real functional advantage. When someone is in ketosis, their brain relies on a mix of ketones and glucose as fuel. Think of a flex fuel car. A meta-analysis showed that the ketogenic diet improved cognition and memory in subjects with mild cognitive impairment and early-stage Alzheimer's disease. What new developments are coming recently for the treatment of Alzheimer's? Why are scientists so optimistic that we may see the end of this disease in the coming decades? Because after more than 20 years without any new drugs for dementia, we have two potential drugs, lanum and donanemab. Both target the beta-amyloprotein. Both are immunotherapies that make your immune system clear. The amyloprotein, which is toxic to neurons. Both drugs improved quality of life and reduced memory and cognitive ability loss. Compared to placebo, of course, these are expensive drugs, but for the future, who knows, they may be used daily by people who have started showing symptoms of dementia. Did you like the video? Remember to share it so more people have this knowledge, although we only help a few people to be aware of the first symptoms of this nasty disease. Also take a look at our other videos about health on our channel. Who knows, you might help someone else with it. Remember to subscribe and see you in the next video. Thank you very much for watching.